NHA CCMA mock test. Question 1. What standard paper speed is used when recording a routine 12-lead EKG? Option A 10 mm/SEC. Option B 25 mm/SEC. Option C 50 mm/SEC. Option D 100 mm/SEC. The correct answer is option B, 25 mm/SEC. The standard EKG paper speed is 25 mm per second, which makes each small box equal to 0.04 seconds and each large box equal to 0.2 seconds in time. This standardization allows waveform duration measurements to be compared reliably across facilities and equipment. Question 2. A patient has been diagnosed with a reportable communicable disease, such as tuberculosis. To which agency is the medical office legally required to report this information? Option A. The Centers for Medicare and Medicaid Services, CMS. Option B. The local or state public health department. Option C. The Occupational Safety and Health Administration, OSHA. Option D. The Joint Commission. The correct answer is option B, the local or state public health department. Reportable communicable diseases must be reported to the local or state public health department as required by state law and CDC guidelines. This reporting enables disease surveillance, outbreak investigation, and contact tracing to protect public health. Question 3. Which of the following nutrient classifications provides the highest number of calories per gram? Option A carbohydrates. Option B proteins. Option C fats. Option D vitamins. The correct answer is option C, fats. Fats provide 9 calories per gram, which is more than double the 4 calories per gram provided by both carbohydrates and proteins. Vitamins are micronutrients and provide no caloric energy. Question 4. A clinical medical assistant is discussing a patient's new diagnosis of macrocytic anemia. What does the term macrocytic mean? Option A unusually small red blood cells. Option B unusually large red blood cells. Option C decreased number of white blood cells. Option D irregularly shaped platelets. The correct answer is option B, unusually large red blood cells. The prefix macro means large and cytic refers to cells, so macrocytic describes abnormally large red blood cells. This is seen in vitamin B12 and folate deficiencies. Microcytic, small cells, is the opposite finding, seen in iron deficiency anemia. Question 5. A patient is diagnosed with cholelithiasis. Which body system and organ are involved in this condition? Option A urinary system, kidneys. Option B digestive system, gallbladder. Option C endocrine system, pancreas. Option D reproductive system, ovaries. The correct answer is option B, digestive system, gallbladder. Cholelithiasis is the medical term for gallstones, which form in the gallbladder, part of the digestive system. The suffix lithiasis refers to stone formation. Nephrolithiasis refers to kidney stones, which is a urinary system condition. Question 6. What type of healthcare setting specializes in providing care for patients who have a terminal illness and a life expectancy of 6 months or less? Option A ambulatory care center. Option B long-term care facility. Option C hospice care. Option D acute care hospital. The correct answer is option C, hospice care. Hospice care focuses on comfort and quality of life for terminally ill patients expected to live 6 months or less. It emphasizes palliative rather than curative treatment. Long-term care facilities provide extended nursing care but are not specific to end-of-life patients. Question 7. A medical assistant is preparing to measure a patient's blood pressure manually. How high should the cuff be inflated above the point where the radial pulse disappears? Option A 10 mm Hg. Option B 30 mm Hg. Option C 50 mm Hg. Option D 60 mm Hg. The correct answer is option B, 30 mm Hg. Standard technique requires inflating the cuff 30 mm Hg above the point where the radial pulse disappears to ensure complete arterial occlusion. This allows the auscultatory method to accurately capture both systolic and diastolic readings. Question 8. A medical assistant is placing electrodes for a standard 12-lead electrocardiogram, EKG. Where should the electrode for lead V4 be positioned? Option A 4th intercostal space at the right sternal border. Option B 4th intercostal space at the left sternal border. Option C 5th intercostal space at the left midclavicular line. Option D 5th intercostal space at the left anterior axillary line. The correct answer is option C, 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space at the midclavicular line on the left side. V1 is at the 4th ICS right sternal border, and V2 is at the 4th ICS left sternal border. Accurate precordial lead placement is critical for detecting ischemia and infarction patterns. Question 9. Which hormone is secreted by the pancreas to lower blood glucose levels when they become elevated? Option A glucagon. Option B insulin. Option C cortisol. Option D thyroxine. The correct answer is option B, insulin. Insulin is secreted by the beta cells of the pancreatic islets of Langerhans in response to elevated blood glucose, facilitating cellular glucose uptake. Glucagon, secreted by alpha cells, raises blood glucose by stimulating glycogenolysis. Question 10. A medical assistant is cleaning up a small blood spill on a laboratory counter. Which disinfectant solution is recommended by OSHA? Option A 70% isopropyl alcohol. Option B 110 dilution of sodium hypochlorite, household bleach. Option C chlorhexidine gluconate. Option D hydrogen peroxide 3%. The correct answer is option B, 110 dilution of sodium hypochlorite, household bleach. OSHA recommends a 110 dilution of sodium hypochlorite, bleach, as the standard disinfectant for blood spills because it is effective against blood-borne pathogens including HIV and hepatitis B. Isopropyl alcohol evaporates quickly and may not maintain contact long enough for full disinfection. Question 11. When answering an incoming telephone call at a medical office, which of the following greetings is most professional? Option A hello, please hold. Option B good morning, Northside Clinic, this is Alex. How may I help you? Option C doctor's office, who is calling? Option D yeah, this is the clinic, can you wait a minute? The correct answer is option B. Good morning, Northside Clinic, this is Alex. How may I help you? A professional telephone greeting includes a salutation, the office name, the staff member's name, and an offer to assist. This establishes credibility and creates a positive first impression. Placing a caller on hold before identifying the office is rude and unprofessional. Question 12. A medical assistant is preparing a patient for a pelvic examination and Papanicolaou, pap, smear. Which position is most appropriate? Option A dorsal recumbent. Option B lithotomy. Option C Fowler's. Option D jackknife. The correct answer is option B, lithotomy. The lithotomy position, with the patient supine and feet in stirrups with hips and knees flexed, provides optimal access for pelvic examination and pap smear collection. Dorsal recumbent is similar but without stirrups, used for abdominal exams. Question 13. A medical assistant is administering an intradermal injection for allergy testing. At what angle should the needle be inserted? Option A 10 to 15 degrees. Option B 25 to 30 degrees. Option C 45 degrees. Option D 90 degrees. The correct answer is option A, 10 to 15 degrees. Intradermal injections are administered at a 10 to 15 degree angle, nearly parallel to the skin, to deliver medication into the dermis. A properly placed intradermal injection produces a visible wheal or bleb under the skin. The 90-degree angle is used for intramuscular injections. Question 14. A medical assistant performs a clinical task that is strictly outside their legal scope of practice, resulting in harm to a patient. This is an example of which legal concept? Option A nonfeasance. Option B malfeasance. Option C contributory negligence. Option D slander. The correct answer is option B, malfeasance. Malfeasance refers to performing an act that is unlawful or wrongful, such as practicing outside one's legal scope of practice. Nonfeasance is failure to act when there is a duty to do so, while misfeasance is the improper performance of a legal act. Question 15. A patient performs a clean catch midstream urine specimen collection. What is the purpose of instructing the patient to void a small amount into the toilet first? Option A. To clear the urethra of external skin flora and contaminants. Option B. To reduce the total volume of the urine specimen. Option C. To test the flow rate of the urinary bladder. Option D. To ensure that the urine collected is from the kidneys only. The correct answer is option A. To clear the urethra of external skin flora and contaminants. The initial stream of urine flushes external urethral medial flora and contaminants from the distal urethra. The midstream portion that follows is less likely to be contaminated, providing a more accurate culture result. Volume reduction is not a clinical goal. Question 16. Which of the following cleaning methods kills all pathogenic microorganisms, including bacterial spores? Option A sanitization. Option B disinfection. Option C sterilization. Option D ultrasonic cleaning. The correct answer is option C, sterilization. Sterilization is the only method that destroys all forms of microbial life, including highly resistant bacterial endospores. Disinfection eliminates most pathogens but not spores. Sanitization reduces microbial counts to safe levels but does not kill all pathogens. Question 17. Which of the following medical abbreviations represents a medication that should be taken 4 times a day? Option A BID. Option B TID. Option C QID. Option D PRN. The correct answer is option C, QID. QID stands for quarter in die, meaning 4 times a day. BID means twice daily and TID means 3 times daily. PRN means as needed and is not a fixed frequency. Question 18. What angle of insertion should be used when performing a venipuncture with a standard multi-sample needle? Option A 5 to 10 degrees. Option B 15 to 30 degrees. Option C 45 to 60 degrees. Option D 90 degrees. The correct answer is option B, 15 to 30 degrees. Venipuncture is performed at a 15 to 30 degree angle, with the bevel facing up, to allow smooth entry into the vein lumen without passing through the posterior wall. A shallower angle is used for superficial veins, steeper angles risk through puncture. Question 19. A medical assistant is calculating the body mass index, BMI, for a patient. Which of the following measurements are required to complete this calculation? Option A height and chest circumference. Option B weight and waist circumference. Option C height and weight. Option D age and weight. The correct answer is option C, height and weight. BMI is calculated using height and weight only, using the formula, weight, kg, divided by height, m, squared. Waist circumference is a separate measure of central adiposity and is not part of the BMI formula. Question 20. When providing discharge education to a patient who has a new surgical drain, which of the following statements by the patient indicates a need for further teaching? Option A. I will wash my hands before cleaning around the drain site. Option B. I should empty the fluid collection bulb when it gets half full. Option C. I can submerge the drain completely in a warm bath tonight. Option D. I will record the amount of drainage in my daily logbook. The correct answer is option C. I can submerge the drain completely in a warm bath tonight. Patients with surgical drains must avoid submerging the drain site in water to prevent infection. Bathing should be limited to a shower or sponge bath, keeping the drain dry. All other statements reflect correct understanding of drain care.